Tougher workspace measures to prevent COVID-19 cases from skyrocketing. There will be more testing and tighter work-from-home requirements. At the same time, a call for people to limit social gatherings to one a day. Everyone is also being urged to self-test regularly.
For a closer look, Professor Dale Fisher from Yong School of Medicine joins us live now. He's also chair of the Global Outbreak Alert and Response Network at the World Health Organization. Professor Fisher, just last Friday, the COVID-19 task force said that Singapore wouldn't need to revert to tighter measures despite the rising numbers that we have been seeing. That's all changed today. How should we view these new measures? Some of them even announced without key details like start dates.
Yeah, hi, Dawn. To go back, Singapore declared that its strategy for transitioning into a COVID endemic situation would be very gradual. It wouldn't be Freedom Day, countdown 10 to 0, and then celebrate it. It wasn't going to be like that. But actually, this gradual transition is proving harder than it seems. And there's a couple of reasons for that. Firstly, vaccinated people, they get very mild disease or even asymptomatic disease. So therefore, the spread in what is now 81% of the population, you can hardly recognise the disease. So you're getting all these unlinked cases, this silent spreading, if you like. The other thing is that we had a package of restrictions, and what we're learning now is that we actually needed them all to keep those numbers down, because even easing some has seen Delta cases, doubling weekly, as you said. So this is not the gradual exit that was planned. So I do understand the new guidance and the reasons that one would want to just slow the exit from the pandemic, because that's the strategy.
Just to clarify, as a scientist, is this increase in numbers that we are seeing, 235 and expected, a lot more, is this increase within the so-called acceptable range for a country like Singapore that's transitioning to living with COVID? And as for these new guidelines, are they enough to do the job?
Yeah, it's a good point, Jill. Surges actually are expected as we go into endemic mode. We expect cases to go into the hundreds, into the thousands. It wouldn't surprise us if we had over 1,000 cases a day in a couple of weeks. But what we do expect is that they're asymptomatic and mild, and you could argue that why do we even need to count them? This whole situation now is about us gaining confidence in what we know about the science, the vaccination program, and how that the vaccination program has turned the disease into a very mild one. Actually, you could also argue that asymptomatic community transmission is beneficial in vaccinated people, because that would serve as a booster. So there's actually arguments against not controlling the transmission now. But anyway, having said all that, I do understand why we just want to slow things down rather than introducing the measures, make them somewhat voluntary.
Well, one of the measures that has helped us to gain some confidence to get back to this sort of new normal or an endemic COVID situation has been that testing has increased. But what other measures do we need now, Professor Fisher, that we might consider to put in place as well to go in tandem with all that testing?
So I'd put a different twist on that. Singapore has done an incredible job in vaccination. It really is extraordinary and second to no one in the world. No one else has, or no other country more than, say, 1 million population has got this sort of vaccination level. So it's really about setting a sort of trailblazing, if you like. I want you to think of like a roller coaster, if I can use an analogy. You know how when you're going up the top of the roller coaster and you just start going over the top and you're about to lose control, and we're currently in that situation where we're feeling like we're losing control. Do we have confidence in the safety of what's ahead of us on that the way the roller coaster has been built and maintained? Do we have that faith to take that that leap of faith, because that's the problem at the moment. People are so used to seeing single-digit numbers, double-digit numbers, and now we're asking people to tolerate high numbers because of the vaccination. So I think it is time to stop talking about more measures and eventually trust the science and take that leap of faith.
Indeed, especially, but you do understand that Singaporeans, as you said, we're dealing with a virus that's becoming asymptomatic and even harder to pick up from the crowd, which is why the government's urging Singaporeans to reduce social gatherings if possible, yet not quite setting the guidelines on the number and the sizes of these groups. And, would that be impactful to you in tandem with trusting the science?
Yes, I think they're compatible. I actually think we should proceed as asked, as Minister Wong said today. I think the guidance has looked after us very well through the pandemic, and what they're asking for is just slow things down a little bit. So I do get that, but I also do believe that eventually we're just going to have to, I guess, be a little bit more thick-skinned about these numbers and trust the fact that the vaccine works. We've all gotten vaccinated for a reason, and now that reason is upon us. We're a little bit to and fro about it, but I think we'll get there. But slowing down a little bit for now, I can live with that. But that leap of faith, I don't think is going to go away.
Yeah, stay the course, sounds like you're saying, Professor Dale Fisher from Yong School of Medicine. Thank you so much for that.